So tuberous sclerosis is not a rare disease. It affects up to 1 in 6,000 people, and it is a condition that affects multiple systems in the body with sort of benign growths, not really tumours, but benign growths affecting many systems. The most common system affected in the body is the brain, but it also affects the kidneys and the lungs and the skin, and rarely other organs such as the liver and the eye and the heart.
Essentially, it's a condition that can be passed down from one generation to the next. So whenever we see an individual, the first step is to see what the presenting problem is, and then decide whether they fulfil the criteria to diagnose tuberous sclerosis. And then the next step is to work out, has this just happened for the first time in that individual? And that's how a lot of genetic diseases start for the first time. And there may not be any family history, or whether it's happened as a result of being inherited from one or other of the parents.
So it's a condition that's present right from the moment that you're conceived, and it is a mistake in one of the genes in your DNA, and that leads to the development of these abnormal growths, and they appear at different ages. So when you're born, you may have these growths in your brain, and they're called tubers, and you may have growths in your heart, but as you get older, it may become more apparent on your skin and in your kidneys.
Tuberous sclerosis is a spectrum and can affect people in a very variable way. So some people may not even know they have the condition. They may just have a white patch on the skin and not much else. Other people can be affected in a way where they can have seizures in the first year of life and major developmental problems. And there's a whole lot of other medical problems that can occur.
So Amelia is our first child, and she has tuberous sclerosis. So that she has epilepsy, she has developmental delay, and she often has quite nasty seizures that send her to hospital.
There wasn't a lot they could tell us really clearly about how things were going to go. It was more a wait and see sort of thing. You'll have a clearer picture of how she's going to be when she turns 2. So you sort of walk away thinking, well, you know, how bad is it going to be? And there wasn't a lot of current information. It was all fairly dated.
I did some research on the condition, and the information that I found was very distressing. You know, I went to a library and saw a whole lot of really kind of old information that was real doomsayer stuff about this condition, because they're intellectually delayed, will, you know, eventually they'll be institutionalised and stuff like that. So, you know, the initial, all of the shock, Sally's reaction as well was just, so she was so distressed.
There's so much information, and it's too much really to take in, and you don't need to be an expert on the very first day. So I'd be trying to get them to focus on what is the current problem, whether that be seizures or a heart problem or just dealing with the diagnosis, and try not to think too far ahead, because if they get on the internet and read up on all the books, they may be so scared that they can't do anything else. They're paralysed and unable just to do the basic things of life.
When we were initially diagnosed, it was just me and my husband in a tiny, small room, and you felt so claustrophobic, and then they're telling you this, and they're giving you the worst case scenario, and he's going to be so bad, and you know, you come away thinking, oh, I've got to get the house set for a wheelchair, and you know, he's never going to walk or feed himself, and it was quite devastating. We took a while to take it all in. We met with the doctors the following day after the diagnosis was made, and had 1 million questions. And since then, we've probably had about 10 million questions. It's been lots of learning with the seizures, with the heart involvement, kidneys, everything that's involved in TS. Yeah, we'll take that home.
Although it sounds like that this is a terrible problem affecting multiple systems, most of those problems don't matter. For instance, the skin lesions are a cosmetic problem but aren't any danger to the child, and similarly even the heart problems rarely cause any, there's something we see on a scan but they rarely cause anything that the child knows about. The brain problems such as epilepsy are more of a challenge, and for many people with tuberous sclerosis, epilepsy is one of their biggest challenges. The treatment of epilepsy is complex, but it usually begins with a single medication, and we try one medication, and that has about a 50% chance of working. If that medication fails, then we try another one. So we go through a range of medications, either alone or in combination, to try and control epilepsy. And for many people with tuberous sclerosis, that leads to good control, but also sometimes not complete control. Uncontrolled epilepsy for many, many months can lead to stagnation in development or developmental arrest. So the child who was developing normally with the onset of epilepsy may not gain any more milestones, or may even go backwards slightly. And treatment can turn that around if it's effective. So if epilepsy occurs in tuberous sclerosis, then it is important that a specialist is involved who's aware of tuberous sclerosis and the treatment options, because it is a specialised area, and in my opinion, aggressive early treatment can change the long-term outcomes for many of these children.
Sarah was born in 1991, and on day 2, straight after her birth, she was diagnosed with a heart murmur and taken off for various tests to another hospital. And basically on day 2 we found that she had tuberous sclerosis. I think the first sign of the seizures, which were at 6 weeks, or infantile spasms, I think that started to unravel the whole mystery about tuberous sclerosis. So I started to understand that things weren't right in a neurological sense.
Well, most people with tuberous sclerosis are diagnosed because they have seizures, and in fact 9 out of 10 people who have tuberous sclerosis will develop epilepsy at some point in their life. The majority of those will present in the first 2 years of life, and there are particular sorts of seizures that are quite special to tuberous sclerosis and that parents need to be aware of.
I guess Sarah started with seizures, and they've progressed and changed over her 16 years, but she'll always have seizures. They started off as a mild infantile spasm, and then she had what they call a complex partial seizure. They've continued pretty much most of her 16 years, and just of late she's developed a grand mal type seizure, which is quite large. But the complex partials are still there, and they're fairly well controlled, and at times they're not controlled. Sarah was very lucky. She had 2 medications finally at 10 months, which we went through a trial period before that she's more or less stayed with over the last 16 years. And it's just of late that we're maybe starting to monitor what she's doing with her seizures and introduce maybe another medication. But seizure control, yes, without the seizures, they'd be great.
Tuberous sclerosis has affected Lizzie in a variety of ways. She's still at nearly 23, remains an uncontrolled epileptic, no matter what we've tried. We have passages of time where she is seizure-free, but they always come back, despite the cocktail of anticonvulsants that she's on. The seizures have caused visual problems, the damage in the brain where the tubules are, so she still is vision impaired. She has very strong autistic tendencies. She has never developed speech. Her behaviour has been very challenging in the past because it was her means of communicating, because she had no speech. So it took us many years for us to work out a communication system where she was able to express her needs. But her behaviour is magnificent now. She's very sociable, enjoys the company of other people. she can't talk to them and she has difficulty expressing her choices, but people who know her are able to communicate with her.
So for a person with tuberous sclerosis, there's a huge spectrum of intellectual problems. Certainly children with tuberous sclerosis need to be observed closely and their development monitored, and if there are early signs in the first 2 years of life that they're having problems with their language or with their socialisation, that we enable early intervention to try and help them get on developmental track.
So from the time she was 3 months old, we were heavily into early intervention because Lizzie had to be taught everything. She didn't know, she had low muscle tone, so we needed physio to get the muscles working, and we needed an occupational therapist from the Royal Blind Society to help us understand what being blind was. But eventually, after a lot of intervention and better control of her seizures, her eyes actually started working. So she's vision impaired now, but she is not even legally blind. So that's been a great development. But basically from diagnosis at 7 months, it gave us even more reason now to continue with early intervention.
Obviously for families, what's with a child who has a seizure condition or autism or a significant learning problem, that's the major complication people worry about, and that's the hardest thing to treat in a way, because traditionally we felt that if an individual has an intellectual disability, there's not much one can do about that. One can treat seizures and make them, take away that problem to the best of our ability, but we haven't thought we can make an impact on their learning. Now, more and more I'm of the view that we may be able to actually help children with their learning early on if we manage their seizures very, very well, either with medical treatment or surgery. But there may be even novel therapies coming through that may actually improve the day-to-day functioning of these children. So the better we can get them in childhood, the more opportunity they have for learning, the better they will be in terms of as adults and lead much better fulfilled lives.
So predicting the outlook for a child with tuberous sclerosis in the future is very variable, and parents can often be scared by reading too much information on the internet or in books about all the terrible things that can happen to people who have tuberous sclerosis. And it's true that this is not the case for most people with tuberous sclerosis, and that they can live a relatively normal life and with support of their family, and that the outlook is not terrible for everybody.
Most people with tuberous sclerosis are diagnosed sort of quite early in life, generally by a neurologist, but in my case it was a dermatologist, because I've never had any epilepsy or any neurological problems. The main sort of obvious symptom in my case was the skin. Here I was thinking, I was just getting these skin markings checked out to make sure that they're nothing serious, and then suddenly I get told of all these other possible symptoms that tuberous sclerosis can have. So I had to go and see more doctors in that year than I can count, and to have everything checked out, like, the heart, the brain, the lungs, the kidneys, the eyes, and all of that. Basically, sort of after seeing all of those doctors, the main sort of result that came back from all that was that, now you've got tuberous sclerosis, but it's not affecting the way that anything's working.
Treatments have improved, anti-epileptic drugs have been discovered and used quite successfully to control a lot of the epilepsy. Teaching and the need for early intervention is so much more acceptable. So the kids are actually getting a much better educational setting than what was available 20 odd years ago. While not many GPs have heard of tuberous sclerosis, unless they have a patient diagnosed with tuberous sclerosis, there's a lot more specialists that are understanding of the implications of this disease. And just recently now in Australia, a genetic testing facility is available. Now, there was no such thing as a gene test a decade ago, but now we've actually have one established here in Australia, available to everybody.
Gene testing may be helpful in the management of families, and also potentially in understanding the condition, or even tailoring specific therapies to individuals thinking about the future.
Parents can be checked to 99% accuracy whether they've actually got tuberous sclerosis, because once a person has TSC, they have a 1 in 2 chance of passing it on to future children. So it's important that we make it as clear as possible whether the parents do have TS. And in the past, an MRI of the brain and kidney scans were all that was available. So having the genetic testing is just fantastic.
I think it's good for parents who have a child who's been newly diagnosed, who sort of doesn't know what the long-term future is. It's good for them to meet somebody like me who lives a fairly ordinary sort of daily life and doesn't have any severe symptoms, because parents are often very worried and often sort of think the worst, and it's good for them to know that tuberous sclerosis can be quite mild, and which it is in my case, and it's possible for people to live a normal lifestyle.
You go through stages of grief, whether you know it or not, and it took me a long time to get to a point where I was okay with the condition. Luke was about 3 before I actually contacted the Tuberous Sclerosis Society. So it did take a while. I was focusing on everything that I could do for him, and finally got the courage to contact them and go to a meeting which they held in Sydney, and it's changed everything.
Coming to a conference or a family weekend or a picnic is just one way of saying, oh, there's so many different types of families, there's so many different types of TS people.
Get some information that's up to date, rather than do what I did and go to some really out of date information. Even the internet, it's not necessarily the best place to go, because there's so much information around it. So speak to to Tuberous Sclerosis Association, and then start finding paediatricians and specialists. And in fact, we've just opened up, or looking to open up, the TS clinic. So areas that are people, doctors that actually know about TS, and that can advise you. So yeah, probably the TS Association is the best place, because we've got all those contacts.
I actually answer the 1300 number for the Tuberous Sclerosis Society, and I get a lot of the initial calls of parents that are still in shock, or wanting some more information. And yes, you do hear some things that most doctors don't know about the condition.
Well, one of the aims of ATSS is to help inform and educate not only the general community but also the medical profession, because there's a lot of doctors out there who know very little about tuberous sclerosis. There's a lot of research into tuberous sclerosis and the symptoms going on, mainly overseas in the US and the UK, and we sort of try and sort of keep aware of that research that's happening, and sort of try and pass that on to medical professionals at the local level. There's a diagnostic testing laboratory that's being set up at the moment to be able to diagnose tuberous sclerosis, much more simply. So our society has been involved in helping to fund the establishment of that research laboratory.
For many people with tuberous sclerosis, their outcome is normal, that they can lead a normal life, and that's what our role is, and the role of the Australian Tuberous Sclerosis Society is to allow people with tuberous sclerosis to lead as normal a life as is possible.
I think at the moment, for families who've got a new child diagnosed with tuberous sclerosis, this is obviously a devastating condition in a lot of ways, but there is an awful lot more hope, I think, in terms of what's available in the next 5 to 10 years than there was in the previous 5 to 10 years.
For new diagnosis, the earlier the intervention you can get, the better. Keep on top of the medications, get the seizures under control, and I think there's a lot out there now making a big difference in the kids' lives.
It's important to be hopeful, but I think it's also important to seek support of other people, and that's why I think the ATSS is really important.
Sarah is Sarah, and I accept her now for what she is. I actually accepted her quite early in the piece. I knew that this is what life was going to be like, and I just get on with life, and she becomes part of our life.
I don't know, someone once said to me that humans have an amazing capacity to love things that aren't perfect, and you're going to love your child regardless of what's wrong with them. And it makes your life harder, but it doesn't make it intolerable, I guess. You learn to live with it. You learn to deal with your circumstances. Everyone does. So you just have to take it one step at a time, each day as it comes.
You know, she's her own special kind of person, and sometimes I look at her and I'm a bit envious in a way, because she, you know, she doesn't have all the concerns and all the, you know, idiosyncrasies that everyone else has. She is a very happy child in her own world, and you sort of think, well, you know what, that's sometimes potentially a good place to be. Maybe we're the special ones and she's the normal one.
She's a delight, and I wouldn't have her any other way.
There are treatments for most of the symptoms of tuberous sclerosis, and that with the developments that are happening at such a rapid rate throughout the world in research in TS, there is no predicting how far and how great that TS person's life can be.